Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. I have Dr. Arianne Missimer. She's a doctor of physical therapy, a registered dietitian, inspirational speaker, educator, and an author. She's a founder of the Movement Paradigm. It's an integrative health center focusing on mindset, nutrition, and movement, blending Eastern and Western philosophies, rooted in neuroscience, functional medicine, and movement science. So, Arianne, thanks for coming. How are you doing?
I'm great. Thank you so much, Richard, for having me.
Well, good. What was a bit of your journey towards creating the Movement Paradigm? Like, where did maybe a little bit of how it started and some challenges you faced?
Of course. Yeah. So I actually went to school at University of Delaware. I went to school for nutrition, and I ended up doing my first fitness competition when I was 18 years old. So I did Miss Fitness America, Miss Figure USA, and I finished and I realized how unhealthy that journey was. I was working out hours a day. I was, hardly eating anything, chicken 6 times a day with nothing else with it. And I kind of recognized that there has to be a better way to health than this. So that led me to opening up my personal training studio. So I was 22. And at the same time, my brother was actually diagnosed with cancer for the second time, and he was in hospice. And I was his physical therapist during that time. And I was, kind of helping him. He lost function of his arm and leg. And sadly, he passed away. But I always say the greatest gift that he gave me was purpose. And I realized how much that we should all cherish life. I watched him fight for his. And, I realized that there's so much more to health and really the whole person. So that really just kind of jump-started my whole career, and I've kind of been going ever since. So I had my personal training studio for 13 years. During that time, I realized that I wanted to go back to school for physical therapy. With that, I realized that everyone was coming into a fitness setting with pain and injury. So I wanted to understand the rehabilitative side of things, not just the wellness piece of it. And shortly thereafter, I was diagnosed with cancer. And I had stage 3 liposarcoma, which was a really rare and aggressive cancer. And I kind of realized at that point that, I always kind of joke about this, but I had been training for it my whole life. So I had, been helping people with mindset, with nutrition and movement. And I felt like this was really putting me to the test. And so
how old were you at this time?
So this was actually just 4 years ago.
Okay, go ahead, keep going.
Yeah. So 4 years ago, and I ended up training for American Ninja Warrior while I was in treatment, as most people would do.
Wow, that's amazing.
And after that, I competed on the show. So I had chemo, radiation, sparing surgery, and when I finished that journey, I was actually working. I had my business, but I was also working at a physical therapy practice, outpatient physical therapy practice. And I'd been there for 8 years as well. And I realized that I wanted to make more of an impact on people, that I had all of these tools. I've spent my whole career in the health field and trying to gain further education, that I really wanted to kind of go back to my dream, which was to have a multidisciplinary practice and with like-minded professionals and really help people get to the root of their problem. And that was really kind of what led me to make the big leap and open up the Movement Paradigm.
So you said you were training for American Ninja Warrior and, working as a physical therapist, and you were having chemo and radiation and all that.
Yes.
How did you do that? Usually that's incredibly debilitating to people physically and mentally. So, are there strategies and things you believe that would, I guess you experienced that was enough to make you able to do all those things while you're still going through that?
Yeah, I just think, Richard, I really wanted to, I did what I know. And that is, once again, I learned so much from my brother, which is to cherish life and cherish every second and the ability to move and the ability to eat well. And that's really what I did. I focused on a lot on mindfulness and breath work. I ate as well as I could. I did micronutrient testing to make sure I was getting in everything that I needed. And to me, movement has always been so healing. And when I faced many challenges in life, I always resorted to that. So working and moving were things that gave me mental, emotional, and physical strength. I recognize it's not for everybody, nor would I want anybody else to necessarily do that. But I think you have to find what's important to you and what helps you to heal. And to me, that was what helped me heal.
So what kind of people do you work with now? And then, I want to go into what's the protocol or the paradigm for them?
Yeah. So I work with a lot of people that are coming in with a lot of chronic health conditions, whether they come in with chronic pain, for example, but then as we do their evaluation, realize that they have a whole host of other symptoms, conditions, or they're just coming in from that perspective and recognizing they have a lot of gut issues and potentially food issues, inflammation issues, and they're just really trying to figure out where to start, kind of what's the first step on their journey.
Okay, so what would be, I know it's different for everybody, but what is the typical steps that you put people through?
Yep. So typically I have everyone do a very, very detailed intake form. So I have a male and female intake form, which is really more of a functional medicine based questionnaire. I will also have people do other questionnaires depending on what symptoms they've provided me with before I meet with them. But I have things for thyroid and yeast overgrowth and other, conditions that might be warranted. And then during the evaluation, I'm really trying to get an idea of their overall health. So, how much are they sleeping? Are they getting good quality sleep? Do they exercise? How many antibiotics have they taken in the past? What kinds of surgeries and, other medical history, obviously. How much stress are they undergoing? And then do they have a means to reduce their stress? And and then lastly is really all of the symptoms that they can check boxes for. And I think that's probably the part that people don't even realize that they have those issues until they see them on paper and then realize, oh yes, I do have that. I do have allergies. I do have sinus issues. So then I really am looking at determining what the antecedents, triggers, and mediators are. So if, for example, someone has a family history of autoimmune disease, then that could be part of their antecedent, meaning that that could be something that could eventually trigger this person to have chronic health issues. Then the triggers oftentimes are stress, but it could be just a life trigger. It could be a virus. It could be something like that that really sets this person off on a path to feeling or not feeling well. And then whatever mediators there are, looking at what are the lifestyle type factors that are keeping something going. So do they have chronic stress? Do they have, are they eating an inflammatory diet and so on? So that way I can, at the end of it, really determine, I like to say, what is the elephant in the room? So what do we think is the next step for, it could be testing, of course, at some point, but it might just be something as simple as, let's try to improve your sleep habits, or let's kind of move forward with an elimination diet and prepare for that. So I try to make it simple and not overwhelming, because I think functional medicine can be very overwhelming for people, and that causes more stress.
Yeah, I was going to say that, right. It definitely can be overwhelming, and some people I'm sure are like ready whole hog to change stuff, but some people you have to baby step them. And then What have you noticed? What areas do people seem to be like, okay, I could do that? And what areas are people like, I don't know, that are tough for them?
I think the food issue is really tough for people. And I'm a big believer in the elimination diet, or a form of that, just because most people are coming in with some type of inflammatory issue. So whether they have skin issues or they're having, bloating and kind of digestive issues, it's still going to fall under the category of chronic inflammation. So when I suggest an elimination diet, I definitely, with a lot of people, feel a ton of resistance. And they'll say, I don't think I could ever do that. And I'll say, okay, well, that's all right. Why don't we just start with one or two things and also trying to increase some overall nutrition as well. So instead of just eliminating, but also let's try to add a vegetable in. But I might suggest eliminating gluten and or dairy, especially if they're having a lot of inflammatory things. And I find a lot of resistance with that. Now they normally come around, but initially people are very emotionally tied to their food. And the second thing is stress. So I think that most people don't realize that they are under significant stress. They also don't realize the effect it has on their body. And I think they also have a really hard time kind of finding the things that give them, that make them feel good, whether it's meditation or walking or nature. I try to give people lots of options, but I think they definitely struggle with that because it's kind of almost I think when they're trying to admit that they have stress or that it's really bothering them and it's really affecting their health, I think that's the part that they have a challenging time with.
So, and then what about the movement part of the equation? It's very important to you, but do you find that other people are willing to do that, or is that an area of big resistance?
So that kind of depends, because I work with a lot of people that have had pain, that have chronic pain, and mainly because they've been to so many professionals and they'll come in and say, well, PT didn't work or chiropractors didn't work. And, and I always think right away that, and sometimes I say this, that it's not that it didn't work. It's just that your body wasn't in the right place to receive treatment at the right time. It wasn't necessarily the tool didn't work or the technique didn't work. It's just that it wasn't the right fit, or someone has had significant fear avoidance of movement. And so that is definitely a challenge, is that, people are afraid they don't know what to do and they're afraid it's going to cause pain. So they kind of keep moving less and less, sitting more and more, which are all the things that of course make things worse. So I'm always encouraging movement. And, sometimes I start with, let's just try walking. Today I had a client and I said, because he's not exercising at all. And I said, can you try to walk 15 minutes one time a week? And he said, yeah, I think I could do that. I said, perfect. So that's a great start. And, we'll just kind of go from there. And so I think it can be so simple, but I do think, yes, you're absolutely right. There is definitely some resistance in moving more or moving with integrity, moving with high quality.
Yeah, I remember feeling that myself a number of years ago. I'd reach for something and sometimes I'd hurt my shoulder, or I remember being afraid of stupid things like, I don't want to sweat a lot and be uncomfortable, or, what if I do wake up and I can't move my back, or that kind of stuff. So is it pervasive that you've seen resistance or fear of movement, or is it just only in certain people?
No, I see it quite a bit. I mean, I kind of have two groups of people. I have some people that do not tune into their body at all. And so they can just sort of push through everything. But those are the people that end up having way more issues. So I'm always trying to slow them down, allow them to kind of tune into their body, really, be mindful of what's happening. And then the others that have the chronic pain are sometimes so in tune with their pain that they do limit their movement and really restrict things. And obviously from a pain neuroscience perspective, it's not actual pain, it's their brain's perception of the pain, especially if they've had it for over 3 months.
Do you have patients that say, oh, that's what happens when you get old, or I'm just old? What do you ask them if they feel that?
Yes. And I always get mad. I said, that is not true. I said, age is just a number. I said, you do not need to feel that way. You can feel great at any age. I think people, I think just when you asked earlier, a misconception, I definitely think that is one, that people think that, just because they're older, they should not be able to do the things they wanted to do or they want to do, excuse me. And I always share that with people that, my goal is to help you to be able to do the things you want to do when you want to do them and not have pain.
So what's the average age or circumstance of like who's your customer avatar typically? More men or women, or certain age ranges or conditions?
So it's about equal men and women, and on average, it's about 40 to 60 years old. And because I do have a cash-based practice, that is, typically my average demographic, and because they're not using insurance or Medicare. So it's typically I always say active in life population, not necessarily sitting on the couch all day, but, pretty active in life, but are dealing with a lot of issues, and for a lot of different reasons. Sometimes it's really, really stress driven. Sometimes they've had, a really just poor history with a ton of antibiotics and things like that. So it's really kind of all over the map in terms of the reasons that they're having issues.
Well, what are some of the most common issues you see that people are experiencing?
Yep. So I definitely see a lot of SIBO, small intestinal bacterial overgrowth. I see a lot of yeast overgrowth. I've also seen a lot of a ton of food sensitivities and intolerances. So a lot of people have like histamine intolerance that can cause like significant pain and neurological responses. So I've seen really a lot of different aspects of that. But, I always like to say that regardless of what it is, it's still an inflammatory issue. So and I'll explain that to my patients as well, that 75 to 90% of all human disease is linked to inflammation. So regardless of what the symptoms that they're having, at the end of the day, it's still an inflammation issue. So it's figuring out, is it food? Is it bugs like parasites or ticks? Is it toxins, trauma? Is it hormones that are driving that? But those are some of the common things that I do see.
Do people experience the actual inflammation itself, meaning that they say, I feel inflamed, or after you help them, they're like, oh, wow, I feel less inflamed? Or is it always like they always express it in a different way? Like, I don't have pain now, or I don't feel restricted, or that kinds of things. Like, do you think people have a visceral feeling of what inflammation is?
I think more and more people do. I actually do think that. I think more people are aware of it. I think I've done a ton of videos on things like that. So I think people are definitely more aware, but they might describe it in a different way. So just to give an example. So the other day I did an evaluation, and she had palpable and visible inflammation everywhere. So her ankles, you could palpate all of the inflammation. And meanwhile, she's coming in for her knee because she has knee pain, but I could not mechanically reproduce any of her knee pain. So as I'm, doing her whole history, I realized she's got a ton of digestive issues, and she had an enormous amount of stress for most of her life. So there was all these, inflammatory mediators that were probably triggering it. I don't know. I haven't investigated just yet. I'm going to have her do some testing. But that would kind of be the next step, is to figure out what exactly is going on with her, because it's not a knee issue at all. It's an inflammatory issue. And then we just have to figure out what that is.
So what's the progression like for someone that you start working with, over the first week or month or X number of months? What is it? What do they typically experience?
So I typically work with people once a week, and depending on if it's just purely for nutrition, I might work with them every 2 weeks, but on average once a week. And my goal is each week to make at least 1 to 2 small changes. It depends on the person, of course. And my goal is always to meet someone where they are. I think that patients deserve that, deserve to be listened to, and deserve to just kind of go at a pace that feels comfortable to them. So I really try to ask questions and see where they are. With that said, my goal is to, after the evaluation, to really figure out what's the elephant in the room, what's going to make the biggest change and kind of give the biggest bang for the buck right away. So it might be, let's just try taking out gluten and dairy, or, so it might be gluten for the first week. And then maybe if they get that down, then it could move on to dairy. or it could take them a whole month or 6 weeks or even 2 months to eliminate gluten because they're resistant to it. So it really does depend on the person, but normally in about, my goal is 4 to 6 sessions for most people. So really in about 6 weeks, most people are feeling significantly better. Whether it's, I've integrated some mindfulness work into their program or movement or of course, the nutrition piece of it. But most people do really well. I've had some patients that, have come in with chronic pain, numerous rounds of antibiotics, surgeries. They've had a yeast overgrowth. And then after doing a specific protocol, do not have pain. One of my clients has lost up to 45 pounds at this point, just kind of continued her journey. I've had people that have, had all these cardiometabolic factors, stress, pain, and then again, with kind of all of those little changes have been able to, feel so much better, decrease their numbers, decrease stress levels, and got rid of pain.
Maybe you should tell people you're a local elephant hunter. Go, wow.
That might work.
They might think you're crazy if you say there's an elephant in this room.
Right.
I'm just kidding. Well, okay. So after the 4 to 6 weeks, then what happens? Do you follow up with them once a month, or people say, hey, I feel good now, thanks, bye, have a nice life?
No, I try. My goal with my patients, I always say, is I want to be a resource to them for life. So my goal is that they always, I guess I should say that when we finish, we'll say the initial part, that they know that they can reach out to me at any time. And most people do. So, I'll say, if you hurt your neck one day, call me and I'll get you in within a half hour, or if you feel like you get a little off track with the nutrition aspect, just let's do a recap. We can do a session and just make sure you stay on a good path. So most of my patients, I'd say the majority always do that. They always kind of continue the relationship and come back when they need it. And, I try to make sure that I provide them with a ton of educational content so that they know that they can come to me at any point.
That's great. Have you ever, if you feel like, or if you think someone's listening to you, has anyone ever not experienced benefit? Or is it, as long as they listen, they'll improve?
Yes. So that's probably the key part. So I definitely have had my fair share of complicated cases. I just had a PT student and she laughed because she said, wow, she said, pretty much everyone that comes in is really complicated. And I said, yes, they are. So I definitely have. And I would say some of those people I think need more testing, but they're also the people that are resistant to kind of going down that whole path. So so I just kind of respect where they are and, from that perspective, but because I think with functional medicine, and I've been a patient for functional medicine, so I recognize very clearly that it can be very overwhelming and it can be very, very expensive. So I am trying to, in my little small part of the world, trying to be a little bit different and really just make sure that I'm not making that process more stressful for somebody, and just making sure that, when they get to a point when they're ready, that I can say, you know what, I think this would be a good test. Maybe you can speak to your doctor about this, to try to help them. But those are the people that I would say do well. They might make a lot of really positive changes, but they might not get to where I personally would like them to be.
How do you interact with people as doctors or other healthcare providers? Is there a tug of war, or do you talk to them, or what's the best way to handle it?
That's a great question. And I'm still working on that. It's been a little bit of a challenge because I typically am kind of going through the patient, and I've been, I'll ask for specific blood work or testing, and I'll ask the patient to really explain to their doctor all the things that they've shared with me, all the different symptoms and, what they've kind of been experiencing. And a lot of times the doctors will not order the test. So pretty consistently. There's been some recently that I've kind of figured out a way to go about it, which is if I have them do questionnaires. So for example, if I have them do a a candida questionnaire, then if it shows that the yeast overgrowth is probably present, then that could warrant the testing for specific antibodies for that. So I've been having them take the questionnaire in, and that way the doctor can see all of the symptoms that they've checked, and that has been helping. So I'm kind of trying to just shift my my process a little bit as well.
What's the difference between a nutritionist and a dietitian?
So anyone can call themselves a nutritionist, but you can't call yourself a dietitian. So a dietitian would be a licensed dietitian. So we call it a registered dietitian nutritionist, and you would have to have taken your RD exam, your licensure exam, and of course passed. So, and then you would be licensed in the state that you are working. But nutritionist, unfortunately, many people call themselves a nutritionist and aren't necessarily licensed to do that.
Okay, so dietitian is the more formal. Okay, I see what you mean. Registered type thing.
Right. Correct. And so it's tough because there's so many nutrition coaches and things like that, but that's something you could do in a weekend course and then be helping people with nutrition, which I think on a very basic level, there's not too much concern, but most people have a lot of health issues when you really start digging deep. So I think that's when you really
that's good. That's good to know. I didn't know that difference, so that's what I was wondering, because I hear those terms, all the time. So now it makes more sense.
Right. And so I could call myself a nutritionist, right? But which would be, accurate, but someone else could do that as well who doesn't have a license.
Okay. And then in terms of the testing, you mentioned way early on, like micronutrient testing, and what are some of the tests that you find asking clients to get all the time? And then where do they get them? Like, I know it depends where they live, but what kind of places would do it for them?
Yeah. So some of the testing, like for example, the micronutrient testing, so that can be something. There are some companies that allow you to order the test and then you can take it to a lab. So every state is a little different. There's different, of course, there's different legalities with it, but that is one option. And if I can have people go through their doctor, that's always better because then insurance could cover it. So I'm always trying that route. And the other thing I frequently recommend is a stool sample, but it's a comprehensive stool panel. And that's something that ideally the GI doctor could do, but typically they'll do just a standard stool panel, which doesn't really show as much. And then I typically do a lot of different blood work. And then there's other things where they could do hormone panels. Once again, if the doctor wouldn't prescribe it or look at certain things, then you could have them do that as well.
But a lot of the the large national lab chains can do most or all of this testing, or do you have to go to specialized places?
No, so that most of them can do it. Is what happens is they'll send you, so some of these companies will send you the test, so whatever the test is, and then you take it to the lab. And then, so you could take it to your Quest or, your lab that you would go to, and then they'll do the test there.
Oh, okay. Okay. I got it. All right. That's good. That's good.
Mm-hmm. Yep.
Interesting. So, so you said you're local, but where are you local to? I didn't ask you. I'm sorry.
Oh, that's okay. I'm in Downingtown, Pennsylvania.
What if someone's, another state? Are you able to work with them, or, how would you do that?
Yes, I sure can. So I do online sessions for anybody that is interested in, sometimes I can consult with people, or if it's more, specific to nutrition or movement or more the physical therapy route, I can still do that. Obviously with physical therapy, the only thing I can't do online is be able to touch them, but I can guide them through different movements and things like that to make sure that I'm looking at everything.
Oh, that's good. And then, in terms of cancer, I know you've wrestled with it, and your family has too. Do you work with people that have cancer? And I know you can't promise cures, but are you able to work with people like that? And if so, what does that look like?
So I do. I would say that I do more of my programming. For example, I have a cancer retreat that I offer locally. I offer in my center. I do a lot of different programs targeting cancer patients and survivors. I don't have a large population of that as my patient population, but I do work with some. I have one person right now who's got metastatic breast cancer. So A lot of times they're coming to me after they finish their treatment and they're looking to kind of figure out what to do and how to do it. And that's kind of when I'll just guide them on, in the next few months, maybe make this change. And then in the next few months, try to do this, just to try once again, not to make it overwhelming. Because I think when you have cancer and you weren't healthy before or didn't have all the right habits, then it's really overwhelming because you think, oh my gosh, I have to change all of these things at one time, in order to save my life. And for me personally, I was already doing all of those things and I still got cancer. So, it's just the way life works.
You don't have to answer if you don't want to, but were you able to make a huge difference in your situation? And do you feel like that, going forward, you think you'll be able to hold your cancer at bay, or any comments on your own situation?
Of course.
It's up to you.
No, absolutely. That's no worries, because that's honestly a big part, I think, of my journey, and also helping other people. As since treatment, I've had significant gut issues and hormone issues. So specifically from the chemotherapy, and then I had 8 rounds of antibiotics in 1 year. So I've been working tirelessly at really trying to rebuild my system. And, I've kind of gone from, or I guess you could say almost the peak of my fitness at American Ninja Warrior, which was kind of a little bit masked because I was feeling like crap, but I was also the strongest I ever was at the same time. It's hard to imagine that. But after that, I really just started to feel, I really didn't feel well. I felt like I was exhausted. I couldn't really work out. I was having a hard time concentrating. And then I figured out that I had all these issues, leaky gut and SIBO, and I wasn't absorbing any nutrients. So I was malabsorption of just about everything. So to answer your question more specifically is I'm doing everything I can to try to prevent it. But, I can only do so much, and I literally am doing everything that I can.
Oh, wow.
So I always say that, my goal is to, God forbid I get it again, that I'm strong and healthy enough to fight it again,
Well, I would think that you came through it and you probably surprised your doctors, I would guess, like out of your cohort or whatever they want to call you. I think you fared far better than most, right?
Yes. Yeah. I was the face of Penn Medicine for a while. They have my picture hanging up. I was on the commercial, and yes, my doctor said, you really taught me a lot about, being active during treatment, because he told me, which we laugh about today, is he said, maybe you should try Pilates. And I laughed. And then I said, do you want to see my American Ninja Warrior submission video? and then he's like, oh my gosh, you've been doing all this. So
that's cool.
Yeah, we had a good laugh about it.
Well, Arianne, so what's the best way for people listening to reach out?
Yes, so my website is www.themovementparadigm.com. And you could also find me on YouTube at Arianne Missimer, and at Facebook and Instagram at The Movement Paradigm.
Okay, very good. Well, Arianne, thank you for coming on the call. I appreciate it.
Hey, thank you so much. Have a great day.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.